Hi, everyone, and welcome to the Three Principles Global Community webinar. The Three Principles Global Community, or 3PGC, is a nonprofit organization that's committed to bringing an understanding of the three principles as introduced by Sydney Banks to people throughout the world. Today, we have Lyn McCright and Teresa with us, and they are going to talk about the principles in nursing, healthcare, disruption, and change. So Lyn and Teresa, thank you so much for being here, and I'm going to go ahead and turn it over to you.
Great,
Well,
thanks.
thanks, Bonnie. Yeah, well, I'm Lyn McCright, and I had an incredible privilege to have been introduced to Sydney Banks back in 1980. So it's been a part of my life for some 34 years now. I've been working as a nurse in private practice as long as 34 years, and I had my very first private practice in Monterey, California in 1986, doing exactly what I'm doing now. We just didn't have a word for it then, but it's a brand new area in nursing, which I've been privileged to be a part of the creation of nurse coaching and health coaching also, because we offer the principles to nurses and healthcare professionals, licensed healthcare professionals who are interested in bringing the principles into their work in view of transforming the healthcare system. So that's where we find ourselves today. I lead also the Three Principles Global Community Nursing and Health Professions Community of Interest, and it would invite any healthcare professional to and wellness professionals to join us there. Teresa?
Hi, my name's Teresa Walding, and I've been a nurse since 1993. I've worked in a lot of different areas, ICU, rehab, home care, currently in PACU, and also a nurse coach. With Lyn and I, when we started our school in 2016, shortly after I learned about the principles, I actually didn't know anything about the principles until October 2015. And that day brought some insights to me, to my life, that I had never even considered before. And that day I saw a vision of how to help nurses and health professionals do better, be more resilient, to be able to handle the stresses that we have every day in our life, to help our patients. But mostly, I think the biggest change has been for me personally. It brought new life to my work. It brought new life to my relationships. And here we are today. We just recently wrote a vision to bring the principles of resilience to all of humanity through nursing. And the reason we wrote it like that was because nurses touch people's lives everywhere, worldwide. And I think the more people that know, the more nurses and health professionals that know about the principles, it will spread to every patient they touch, because they will have a different come from that I think is very important in changing times, as we'll talk about in a little bit while we're here. Lyn?
Mhm. Well, yes, it's a huge vision, and yet at the same conference that Teresa was mentioning, I actually had the opportunity to stand at the podium. And as I was looking out at the audience of nurses and health professionals, I realized that I was standing on the same cliff where Florence Nightingale had stood. But instead of the dying soldiers and horses that she saw, what I saw was the dying healthcare system. And I knew that I couldn't do it alone, but that working together, we could bring the principles to healthcare, thereby transforming the healthcare system into a true health system. So it's such a privilege to be part of the brand new area of certified nurse coaching, there are actually 5 private schools that offer training in that. And I didn't want to limit myself to just nurses. I wanted to open it up to all licensed health professionals. So health professionals can learn about the 3 principles and get a health coach certificate from us.
You know, it's been a really wild journey for me as far as learning about the principles, opening a business, teaching other nurses about the principles has just been a journey that has opened so many doors to all of the different ways that we work, you know, as far as the places that we work, the people we see, we have our own personalities and all of that go with it. But the most miraculous thing, I think, is when our students see what we're talking about with the principles, we've watched them change in ways that just is unreal. We had one nurse who had never, ever taken a trip by herself anywhere, ever. And after learning about the principles and realizing that it is thought and that it is a thought-created world, she's been traveling by herself all over the place and making new friends and enjoying it. You know, that's just one person. If we can touch everyone in whatever specific way that they want, we have an ability to change anything. Lyn was talking about the healthcare system. It is broken. We know that. We were talking just before we got on here and how 2 of us on this call have had appointments today, and how nice it is to just go in and be seen, be talked to, and out of the office within just a very short period of time, versus how it used to be where you would wait and wait and wait in a waiting room, and it might be an hour or 2. I think the principals have the ability to take this situation, this pandemic, and change it to a person-centered care, like real people, which will in turn look like health that we've never seen before. It's really amazing to me that we can become mentally healthy and physical health follows.
You might want to share your experience, Teresa, at the conference.
I think I've shared that before. So the day that I found out about the principles, I had been going through quite a lot of stress, stress with children, stress with job. And as a result, I was having just a ton of pain in my body. My fingers hurt, my feet hurt. I would have to think about standing up before I could stand up, think before I sit down, because I knew everything was going to hurt. And Dr. Blevins was our teacher that day. He was the keynote and the guest speaker for our conference in 2015. And he talked about how thought works, how we each have a separate reality of this life experience, and that no 2 people could ever think the same. Well, in my little way of trying to help my family and help myself, I was hanging on to a lot of worry. And, I figured the more I worried about it, maybe bad things wouldn't happen. And when I heard that that was absolutely not true, I had this feeling down to my back and out my hands and feet, and the pain disappeared. It was like a side effect of hearing the truth of the principles that created a healing within my body. And the pain has not ever come back. It'll be 5 years in October. I'm not saying we never have any pain, but the amount of pain that I was having, nothing has compared. And, I know that the principles, it's so difficult sometimes for me to put it into words of how the principles work, and knowing that it is a thought-created world, and that's all that's happening, has the power to heal my mental health, my physical health, and to enhance my personal relationships, and actually to turn my career around. I was thinking seriously of getting out of nursing because there was just no way for me to continue with the amount of pain that I was having. And it has been an eye-opening experience to learn how to teach this to people. And we know we can't teach it, it's not in the words, but our best attempts to help people through describing what the principles are is having an effect. Even in my little hospital, just the conversations that I have with my fellow nurses, people want to hear. They want to know how to get better. They want to know how to do it. And of course, when we talk about there is no doing, because it's an insight that this is actually how it works, that helps people to see the implications for their lives. And it's different for each person. I'm thinking, go ahead.
No, you do.
No, I was just thinking of one of my nurse friends who we now call the story "It's Not About the Fish." And so she was at lunch and we were talking about the principles, and I was pretty new to trying to describe what they were. And she said, well, tell me about this then. I'm at home, I'm fixing a healthy dinner, I'm cooking fish, and my husband comes home and he smells the fish and he's instantly in a bad mood. And she's like, I was mad at him for being mad at the smell of the fish because I was in such a good mood, and all of a sudden, he comes in the door and everything is different. And so they argued about it, and she said, finally, I just threw the whole thing in the trash and went to bed. I said, well, if you think about it, that was completely separate realities. There's no way that he knew what you were thinking as you were preparing dinner. And he got exactly what he was thinking when he walked in the door and smelled the fish. And he's like, oh, how often do we have little quarrels like that, not realizing that we're each coming from a completely separate reality? And she said, that's right, because later on I found that he had a bad day and he came in and he wasn't expecting that. And, they went to bed, they finally made up. But I said, well, the whole thing was not about the fish. So for days she'd walk by and she would be having an issue at work or something. She's like, it's not about the fish. It's not about the fish. And so it helped us kind of lighten the mood and lighten the load in a lot of different ways at work. And it was just one example of the many conversations that I've had with people that really helps inspire them to see something different, to not take everything personally, or actually be responsible for how other people act or feel. And it's an important thing to learn, especially in healthcare today. There's a lot of fear and trepidation and burnout. I hear people, especially when COVID first came, talking about, I don't know how much longer I can do this. And I'm going to have to think really hard before I come back tomorrow. I heard that many times. And they always showed up, and we're still working, and it has gotten better, but it's still not about the fish. It's about how we perceive our life and our world through our personal use of the principles.
Oh, Teresa, I'm always so inspired when I hear you share your experience with not just your personal health, but with colleagues as well. I know that nursing is the largest profession in the world. And as such, we have the opportunity to touch more people's lives than any other profession. There are actually 4 million nurses in the United States alone. Only 1 million physicians, but 4 million nurses. And the same numbers are true worldwide. So it doesn't surprise me that the bringing the principles to healthcare has fallen to the largest profession, because we have the numbers that will be needed to transform what is a broken system into a true system of health. We were so privileged to open our school 4 years ago. When we opened, we actually opened on 3 continents. And how is that possible even? Well, because the issues of nursing are the same worldwide, and they're not unique to any given country. Nurses are have such a close bond, and are affiliated through their organizations, their associations, and we have a different trust level than other health professionals. Just for example, every year for the last 18 years, the Gallup poll has shown that nurses are considered the most ethical and the most honest of professionals. And so therefore, we're considered to be the most trusted. And having that trust of the profession is so important in our work with the public, because when people know that we have their best interest at heart and are willing to spend time with them, talk with them, help answer their questions, then that's the most direct way to share, I want to say share the love that are the principles, because we can bring that sharing into every part of our work. One time I wrote a little 17-syllable haiku, and it said, "Carry it in with the bedpan, the heart and the mind of the nurse, wisdom." So that was about the principles and about bringing the principles. There's no part of our lives as health professionals that won't be touched by the principles. So Teresa and I have had the opportunity to meet with various state nursing associations, national associations, podcasts, radio shows, and we're applying to speak to the Texas Organization of Nursing Leaders. So we know that the principles have I wanted to say a big role to play in what we're doing professionally, but in reality, it's the largest role. The principles have the largest role to play in people identifying their own health and living from their own inner wisdom, which they can find, which all of us find through insight. Just as Teresa found through insight that her worry and concern about her family members were creating a physical challenge for her, we can realize for ourselves what the next step needs to be for us to take in our own health and in the health of our families and patients.
You know, it's funny because we had a coaching call with a man named Steve Hardison 3 or 4 years ago now. And he gave me a book called Disruptive. It's by Jonathan Kaiser. And I read it like immediately. I read it while we were on our trip there. And the big takeaway I got from that was, you disrupt a company or a system or a service through selfless service. And people, don't know what to do with that. And I see the principles as disrupting healthcare in a good way, in the way of if everyone I worked with knew about the principles, even on a bad day, would be better than some of the days that we have now. You know, overwhelm and long work hours and very critically ill patients, and in a time of pandemic, you know, this is a real thing. You know, I never thought I would be on the front line of a pandemic in my whole life. You know, it wasn't something that was on the radar, and yet here it is. You know, initially it came to me and to my life as fear, like what if? And I suffered for about 2 hours of all the what ifs that could happen in my life, because now this is like on my doorstep. And I thought, okay, so I know about the principles. How do I deal with this? Knowing I know this is my thought creating my reality, but it looks like there's something I need to pay attention here, something I need to do. And I just kept thinking of all the ways that, you know, COVID could touch my family or my coworkers or even my community. And I worried myself so much that I went ahead and got in the car and started driving around. And I started looking around, and by this time it's night, the moon is out, and it's bright. And I was like, you know, you're really suffering right now. What's this all about? And I realized it was about loss of control that I never had. It was never really there. It was about future thinking about things that might happen. My daughter also works at the same hospital that I do, and I thought, well, what if it takes my daughter? You know, we had no idea at the time what that meant to anyone. And suddenly I looked around and it was calm, it was quiet. I saw people laughing. I saw the brightness of the moon was incredibly bright that night. So you could see a lot of things going on. Nobody was in a hurry. No one appeared to be angry feeling. And I settled down and I was like, you really did a lot of suffering right now, and nothing has happened. And I've kept that in my mind this whole time going to work with, you know, having to gown up and mask up and all of the stuff we do to protect ourselves and our patients, and realized I am always safe in the moment. Whatever moment I find myself in, I'm as safe as I've ever been, even in the middle of a pandemic, taking care of a COVID patient. And it brought me home, and it's brought me peace that I didn't know I could have. It's a calmness of, how do I want to say it? It's a calmness from the inside. It's not, there's still chaos around me. There's a lot of people having, quote, bad days, or, you know, acting out, or whatever you want to call it. But I've noticed that the people that I've shared this with, even just a little bit, are doing better than the people that don't know at all. And that brings home again the reason why I want to teach, quote, teach this to nurses and health professionals, because we've always been on the front line, even when we didn't know what was out there, or when we thought we knew what was going on. You know, there's no way for us to ever know what's coming our way. So I just wanted to share that a little bit, that, you know, the principles are here to help us in every moment, even when we find ourselves worrying about whatever's happening now. There's really nothing to do. Take care of yourself, be in the moment, make memories now, and just keep moving. That's life.
We've seen a lot of political unrest connected with or following the pandemic. And Teresa just surprised me in the biggest way the other day when we were talking about disruption. And she's also already mentioned that. But what she said to me was so beautiful. She said, the disruption is people knowing that it's all thought. The disruption is the principles in action. The disruption is people coming to their common sense about where their wisdom lies. So do you want to just talk about disruption and change, Teresa, a bit more in regard to disruption being understanding thought?
That was my insight, that the disruption of healthcare is when we know where our experience is coming from. And it kind of came as this image of all these thought bubbles going up and then disappearing. Like, you know, it's all thought. And then, you know, when the disappearing of the thought bubbles happened, it was like everyone knew that that's what it was. And we created, this is my vision and my little insight that I had, a world where we actually take a person, not a system, and help them find their own healing, their own health. And, you know, there's a lot of ways that we do that. You know, nurses are real good at, you know, telling people what to do and how to do it and all the things that we've read and learned. But there's a difference when somebody actually sees the value of it for themselves and takes their own action, not for the doctor or the nurse or whoever's trying to help the person, but for themselves, because it is a thought created world for that person. You know, there's a lot of things that we throw up as roadblocks. You know, we can hear the information. You know, we've talked diet and exercise for a long time. And some people find the value of it, they take action, and they do become healthy. But how do we help the people who can't see it for themselves, or who have such low self-esteem that they can't, quote, make themselves eat better or exercise? That comes from a different place. And one of our students has a perfect example. When she works in a diabetic clinic, she's a nurse practitioner, and she had a little 83-year-old lady who had diabetes, but was completely living in the past. She had 4 family members die in 4 months. That's a lot for anyone. And she wasn't taking care of herself, and she was, you know, mourning their loss. And Jan asked her, well, you know, you're still here. What do you want to do about that? She said, you can't live in the past anymore. It's not there. And she's like, okay. And then she said, do you mean that I'm not taking care of myself because I'm thinking about them? And she said, you're right. She came back with more blood sugar checks than she'd had in a whole year, 3 months later. And an A1C, which is a level in the blood that tells how the diet has been going in the past 3 months, that was perfect for her. Now that didn't come because Jan said, oh, stop thinking about the past, you know, it doesn't exist. She had to help her see that. And that shifted her to take an action that she hadn't done in a year. And we all have something like that in our lives, where we are resistant to it, where we can't see our way around it, or we think we don't have time. All of that is an illusion. We make the time or take the time for the things that are important to us, always, because that's where we come from. That's where our life is being lived, in those moments. But we get so busy worrying about, oh, I should do this. Oh, I should do that. They told me I should do this, but I don't really want to. And we can live in that space forever. So I see the principles as disrupting healthcare in a positive way of helping people see their own whys and their own reasons for doing things. That brings insights to that person that can completely change their life. And we didn't do anything. We just let them, or we're the witness for them to see it for themselves.
I love the example. One of our nurse coaching students was working in the emergency department one night, and they wheeled in a young man, just 25 years old, who was too morbidly obese to ambulate independently. He could not even walk by himself. And he said, I want to make some changes, but I want to find out from the doctor what is possible. I'm here to talk to the doctor. Well, so the nurse coach said, well, the doctor's over there and can't come right now, but let's have a conversation. And as they were talking, the conversation rolled around and she said, let's talk about calories. She said, you know, calories are energy, and you are all fueled up to go in any direction you want. He was so inspired by that. We can't know what the resolution was, but just the fact that that healthcare provider spoke to him in a very positive way, and that he realized in that moment that all the limits were off. There weren't any. He could go in any direction he wants. And what a beautiful thing. It was a tiny little interaction. It didn't take much time, but the insight that he gained may have been life-changing for him. I know Sid Banks spoke about insight and realization so often. In fact, the name health realization has always been really beautiful to me. And that was what the principles went by before it became the three principles. We knew that the benefits that are derived from our work are so outside the box of what is currently seen as possible within healthcare. And that's been part of our challenge. You know, even speaking at national associations or state associations, we've been advised, don't say you have the answer. That's a red flag. Your application will be thrown out immediately. But, you know, we have to learn to work within the system, the paradigm that exists now, in order to bring our colleagues along with us. So it's the articulation of the principles and being able to bring those individual opportunities to nurses and health professionals for themselves first. We happen to work with American Holistic Nurses, and one of their three major tenets is taking care of the nurse first. Well, that is something that healthcare as a whole has not done a very good job at, because they always see it as the outside. They see it as the environment around the healthcare provider, not that the healthcare provider has a responsibility and a joy to take care of themselves first. But it's all part of the evolution, and we're along for the ride. I know that we've enjoyed watching our students within our nurse coaching and health coach program just blossom themselves as they've had their own realization. And we're always focusing on the individual, the healthcare provider first, and the client, the patient second, because that's the way this works. You can only share what you know, and the experience that people have of their own understanding of their own health is what will resonate with people who are listening. So right now, Teresa and I have a beautiful opportunity along with one of our students, to work with the National Black Nurses Association. And they're putting on a virtual conference for the very first time, which we're assisting them with. Our student is the first speaker on the first night of the opening day of the conference. And it's been a group that we've been affiliated with for 4 years. Well, why would we choose this particular group to be working with? Well, the National Black Nurses represent 380,000 nurses, for one thing. For another thing, they have nurses in administration, nurses in education, nurses in practice. So they cover every area of the profession, and they're all across the nation. And the way that things have come about, we now have even put in an application to work on a much larger scale with them, working with a group of 200 frontline COVID nurses. So we should find out sometime this month if our application has been accepted and if we can begin to work with those COVID nurses. And what will we be bringing to those nurses who work on the front line? The principles. The principles, the principles, the principles. Because when you understand how your life works, you understand how everyone else's life works. And that knowledge is priceless. Teresa?
Yeah, I was just sitting here thinking about working with all of those nurses and, maybe some of the different ways we might need to do that, especially with people who have been frontline for a long time. And one of those ways to do that is to really nurture those nurses, to let them know that they're okay. That, sometimes I have talked to several nurses who really have a lot of thinking about taking care of their patients, but they always come back and say, if I don't take care of them, who will? And so they keep showing up and they keep showing up despite the stress and fear and, the potential of taking something deadly home with them. And yet they're taking all of the precautions that they can. I know 2 nurses who worked in New York from the beginning of the pandemic. One was our OR nurse and another was just a friend, but they both came back and they were like, I've never heard so many codes called in such a short period of time, that I was there several times a day. And she said, after a while, you just keep doing and doing and doing. And I had talked to my friend that works in the OR before she went, and she was like, our conversation really helped me. So I'm not sure what you said, but I felt better. And so I was like, well, that's an interesting thing to say, that, how can you just feel better by having a conversation with someone? And she, we have plans to talk again, but as it's been turning out, we haven't had a chance. But those are the conversations I want to have with these 200 nurses that we may have the opportunity to work with, because every one of them will hear something different. But one thing that keeps coming back to me, as long as I keep talking about the principles and how it works, and that it's a thought-created world, and that this is all that's going on. Sid Banks said in one of the tapes that I listened to that you can talk about it in all different ways, but when people hear truth, they hear it the same. And I took that as the same as they're a fact, they're real. They help us to grow and change and to drop a lot of negative thinking that allows our best self to come forward, to heal bodies, to heal people. And that's what I went into nursing for, was to help people live better lives. I know that for some people, it might mean helping them to transition to the end of their life. And in the cases that I've been very present with people in that case, there was no other place to be. It was a gift to me to be there at that time. And I think it was a gift to them to have someone be there with them. And I just know that this is a world where we have the ability to connect people, to love people, to do what we can to make life better. And I've never found anything in my life like the principles that have helped me do all of those things effortlessly. I wrote a goal, gosh, it's been 20 years ago now, that I wanted to know something that would help people in the middle of the night when no one was around. I know they're the principles. I know it for a fact that this helps people heal mentally and physically. And for me, there's no other place to be. I want to be here right now, helping people to heal their lives in a way they've never experienced before. And I know it's possible because it's happened for me. That's my true test. If I can do it, anyone can. You know, it's one of those places where it's not just for me, it's for everyone. And just knowing that, I'll keep talking to whoever wants to talk, to have a conversation about it.
We know that this will bring complete change to the system where we will be working. So we've been careful to include in our application the opportunity to talk with the chief nursing officers and the chief executive officer of the facility, as well as the supervisory nurses, because even though we'll be bringing it to the nurses on the front line, the ones that are there with the patients day in and day out, nevertheless, they will be supported by their superiors, their supervisors, and their chief nursing officers. And the transformation that will come can be maintained within an organizational system if it's seen uh, from everyone within the organization. So it's an incredible opportunity that we have. The National Black Nurses represent 380,000 nurses. So we have nurses who are looking, nurses who know that there's a better answer out there for our professional work, and they've remained open because they've never stopped working. They've never stopped looking. And it really is true. I mean, in my position as leader of the American Holistic Nurses, I've known people who have gone on strike in nursing. I've known people who have nurses who have been strike breakers in nursing. I just have known the whole range of clinical areas, geographical areas, and we even had a nurse contact us from South Africa the other day. I'm excited about the possibilities. So we know that we're just, when people are in crisis, as they are when they come to a healthcare system, they come there when the baby's born. They come there when someone is dying. They come there in an emergency situation. And in all of those situations, the public would step back, but healthcare workers step forward. They want to be there to help. And we're a group of people who understand humanity, but we're going to have the opportunity now to share with them a much deeper understanding of humanity through an understanding of how thought works, and each person experiencing their own separate reality, as it were, through their own personal thoughts. and not judging that, but having an opportunity to step back and get a perspective and realize that their life is not our life, and we can't dictate to them how their life should be lived. But if we can help someone have an insight, have a realization about where their health comes from, then our mission will have been achieved. I just think that we'll have a system ultimately where it really will be only the nurse in the emergency department, the nurse in hospice, and the nurse in labor and delivery. The rest of us won't be needed because everyone will be taking care of themselves first.
It's a big vision, and it's an exciting vision to think that we have an opportunity to help heal the world in this way. And I know a lot of people have the same vision as we do. We just happen to use nursing as our vehicle because obviously we are nurses. And, the opportunity came when we realized that through nurse coaching, which is an actual education program that Lyn and I started in 2016, that would allow nurses to actually come to us and get board certified as nurse coaches. And I see that as the next step in nursing. We've been coaches our whole lives. We are patient advocates. We are champions for the patients. We take care of them. We wanted to come into a profession to help heal people, to, make a difference, to care about humanity. And when I saw that the principles changed me as much as they did in that one day, in that one moment, I knew there was hope for us. I think Lyn had some statistic about how long graduate nurses stayed in nursing, about 2016 or so. It was 18 months. We need to grab those nurses and hang on to them. We're going to need them. We need to nurture them and mentor them and take care of our nurses too, to be there for future generations, to become self-sufficient enough to make a difference in the world, to bring health to a nation, to a world. I see now the only way that can really happen is when everyone understands the principles of resilience as we're teaching it through our school. Open to any, ideas or comments about how we could do it better or different directions to go. But right now, that's the only one I can see where I can personally go show up every day and talk to my fellow nurses and healthcare providers. And right now, that's the mission.
Yeah, in our book, everybody either is a nurse, knows a nurse, or has a nurse. So there's nobody whose life is not touched by nursing. Well, what do you think at this point, Bonnie? Do we want questions? What would you suggest?
Sure. Does anyone have questions or comments? If you do, you can unmute yourself or you can raise your digital hand by clicking on the participant icon on the bottom of the Zoom screen. And then when the little white sidebar pops up at the very bottom, there is a raised hand. Anyone? Vera?
Can you hear me?
Yes.
First of all, apologies for camera of my internet is very wobbly.
Okay.
So I'm not trying to hide, but I've struggled earlier today. So
We're glad to have you here. Thank you for coming.
And I just wanted to say how touched I am for the bold vision that you're holding. something that's never occurred to me, that like nurses being in such a crucial position and being so many of you, that you really can change the world. So I'm going to hold that vision with you.
Wow, thank you.
Thank you.
Yeah, thanks for the great work you're doing. And it is a bold and inspiring vision. And I'm curious how you'll share in practice the principles. Would it be through the coursework and your personal connections with your colleagues? What else is in your toolbox for, I guess, getting the word out, if you will?
Well, we do have an 80-hour continuing education program that is primarily pre-recorded videos that Teresa and I created in 2016. Beyond that, we do have a live coaching call for the class every week. And so that's available to the students. And then as our students graduate and become certified or become health coaches, we also have 3 opportunities every month to get together with them. One of which is our Austin area holistic nurses chapter meeting. And the 2 other opportunities are our 3 principles global community nursing and health professions gatherings. So staying in touch with people 3 times a month is an opportunity that's available to not just our graduates, but anyone within the principles. And we would welcome you to join us in our 3 principles global community for nursing and health professions.
Is there a website you could share that would connect people to your
Well,
work?
we would invite comments. Our website is real simple. It's just 2 words: nurse, NURSE, coaching, COACHING, nursecoaching.com. And you can leave a comment there for us. Thank you.
I just wanted to mention real quick that we also have a mastermind group, which are people who have taken our coursework. And in that group, we are talking about how to bring this to a bigger platform. An association for nurses who are certified nurse coaches, and also how all these people are bringing the principles to their workplace. You know, not everyone wants to be a coach in private practice. So people are taking the principles, just like Jan did with her 83-year-old patient. You know, we interact with people and educate people all day long. That's our job. So we have opportunities for conversations wherever we work. And that's kind of another avenue that people are getting involved in, bringing it to their facilities. One of our students is in charge of education, so she incorporates the principles into what she puts out for education. So there will be a lot of different ways. As many people as there will be ways to bring this to wherever nurses work.
Thanks for your questions.
I think that's it.
Yeah, thank you guys so much. Such great work that you're doing, and I hope that all of the applications that you have in to further what you're doing come through.
Thank you so much, Bonnie. What a privilege to be here with you. We're so grateful for this community, the support of this community, and just the opportunity to be here with you today. Thank you.
I'm very happy that you came on. Thanks. And then I just want to let everybody know that on Monday, the September 21st is the next webinar, and it's with Sherry Ray. So hopefully you can all join us live then or listen to the recording. Thanks again.
Thank you.
Thank you. Bye, guys.
Bye.